CWD is the acronym for chronic wasting disease, which is a prion disease that's found in ungulates, in deer, elk, moose, and now caribou. Prion is basically a misfolded protein. We all have proteins in our body that are in a certain structure, and this particular protein that we call a prion is a misfolded, so it's almost backwards, and that misfolded protein is the thing that seems to be associated with the disease that we call chronic wasting disease. We don't know, and that's one of the dilemmas. When the protein misfolds, it seems to be much more resistant to being destroyed than the normal protein. So the transmission then is really something that we don't understand. We don't know how it goes from animal to animal. We know that animals that are affected with chronic wasting disease excrete prions in their saliva, in their urine, in their feces. It's in their nervous tissue, it's in their lymph tissue, it's in their skeletal muscle, it's in their blood. So the animals have lots of places that the prions can be and be released into the environment, but we don't know how that protein goes then from the environmental contamination to another animal, because it's not a living thing. It's not a bacteria, it's not a virus, it's not a parasite, it's not living. So how it goes from an animal to the ground to another animal, or direct transmission from an animal to an animal, we don't understand, because it's not a living agent.
There's no cure for CWD.
If an animal gets chronic wasting disease, it's a uniformly fatal disease.
This is a disease that will eventually kill the animal.
It takes sometimes months to years for animals to die of chronic wasting disease, and they typically don't die of chronic wasting disease. They die of starvation, they die of aspiration, pneumonia, those kind of things that CWD seems to predispose them to. But if you get a prion disease as a deer or an elk, it is a fatal disease.
The biggest thing that hunters can do is, number one, stopping at our check stations. Hunters are an integral part of this. We need to get as many hunter-harvested animals as we can to test for chronic wasting disease.
I'm going to take a sample from the throat.
In different years, we'll be sampling in different locations, so it really won't be anything different as far as what hunters are used to. That we'll have our check stations out there, and folks are just going to need to be patient. If we're sampling in your area, we're going to need to get as many lymph nodes from the animals that we can.
So, first lymph node is right here. The disease will show up in the lymph node first, and it will progress through deer in a way that it will then house itself in the obex, which is the brainstem. So that's why we take all the information, his tag number, location, age of the animal, species, because we want to be able to find what location we detected it at in the state, and we also want to be able to tell the hunter that we found chronic wasting disease in his animal.
So in the past, we've sampled for CWD statewide every year. What we're switching to now is we're going to sample in certain parts of the state, and we'll rotate around the state. The reason we're doing it this way is we need to get a lot of samples for a given population to be confident in our ability to detect the disease, and if we spread our samples out all over the state, it reduces our ability to do that.
However, check stations alone will not be enough to get the sample numbers needed. So for those areas in the yearly rotation, Idaho Fish and Game asks hunters who do not pass through a check station to voluntarily bring in their adult deer heads to Fish and Game offices. The staff will then remove the lymph nodes.
We need heads that have a little bit of throat in them. So if they'll feel for the hard cartilage in the throat and cut just beneath it, and then bring in the rest of the head, that would be perfect. They can bring it to any regional office. We are requesting samples from adults and yearlings. Fawns are a little too young to have detected it, and for us, for the prion to have been built up in the body.
Anytime a hunter, or not even a hunter, any citizen for that matter, if they do see a sick animal, something doesn't look right, they should call us immediately and we'll come out and assess the situation. But the probability of a sick animal having CWD is much higher than just animals randomly harvested. So those are going to be critically important moving forward to detect CWD.
I want the public to know that you know, it's a very important topic, and that this disease could have impacts to their experiences, whether they're hunters or wildlife watchers, and that being informed and engaged is going to be important and really help us manage the disease if it ever does show up in Idaho.